Welcome back to Medic Mania. Today we're going to be going over how to use an AED, and we're going to be going over pad placement for adult and pediatric patients. AED stands for Automated External Defibrillator. So what it does is when someone goes into cardiac arrest, it will restore basically an ineffective rhythm. So if they're having an arrhythmia, which is anything that's other than a normal sinus rhythm, a normal heartbeat, this will come in and it will shock whatever rhythm it is to restore that normal rhythm. So you'll usually see them packaged in a package like this, or you'll see them, they're usually up at libraries. A lot of public places have them on the wall. So if you're ever looking around, you'll find one next time you see it. But they usually come in a package like this. They have pads, and then you also have your AED device. This is a training device only. The normal ones are usually a lot bigger, so just keep that in mind. Alright guys, so in the introduction of how to do CPR, in that video at the beginning, once you check for responsiveness, you realize that person needs help, you say call 911, go get the AED. Well, now we're at the point where the AED has arrived. We're going to go into how to put it on. Okay, so the first thing you're going to do is you can go ahead and put the pads on. So it does matter how you put them on. So this one is going to go on the upper right of the chest, and then this one's going to go on the lower left side of the chest. Okay, I'm going to put that there. Lower left. This one's going to go on the upper right. Okay, perfect. Now, I'm going to turn on the AED. You're going to follow the prompts. It's dummy proof. It'll tell you exactly what to do.
Patient bare chest.
Okay, so the pads are already applied. Okay.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
This is your pad connector.
Do not touch the patient.
Okay.
Analyzing
Stand
heart
clear.
rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging.
Okay, make sure everyone stands clear.
Stay clear of patient.
You don't want
Deliver
anyone
shock
close.
now.
Okay.
Press the orange button. Now.
Shocking.
Shock delivered. It is safe to touch the patient.
Okay, continue compressions immediately.
Begin CPR.
The most important thing when using an AED is when it's about a shock and it says preparing to shock, everyone stand clear. Everyone needs to stand clear. Don't just say it, but make sure you visualize it and no one's touching the patient. Once the AED does deliver the shock, you're going to immediately resume chest compressions. You're going to do a 2-minute cycle at a 30-to-2 ratio. You're going to continue to do that until either help arrives, you're too fatigued to do any more. At that point, you would swap rescuers, or the patient's responding, you get return to spontaneous circulation. When using AED, it's important to consider the fact that pediatrics can use adult pads and pediatric pads. They work for both. I'll show you the placement here in a second. However, adults can only use adult pads. They cannot use pediatric pads. All right, so now we've seen placement on an adult patient, we're going to go ahead and put them on a pediatric infant patient. Okay, so everything with the AED stays the same. You follow the same prompts. The only main difference is the placement. So with a pediatric using adult pads, you're going to do a posterior anterior placement. If they're using pediatric pads, then you can just follow the directions on the pediatric pad label. Okay, so what you're going to do is you're going to take this. So this is going to be on the back because it's on the lower left side of the chest. So this is going to be the posterior. Posterior is the back. Okay, right in the center of the back. That's the posterior side. Okay, and then now on this side, we're going to put it on the anterior, which is going to be the center of the chest on the pediatric.